Oh, hey, Dr. Amy here. Hey everybody. It's a beautiful morning here in Charlotte. Got a new coffee brew today in my awesome Mickey Mouse mug. What is it, 100th anniversary, 2018, from a dear friend / patient. Awesome roast today, not sponsored, totally should be getting some coffee sponsorships, but Magnolia Coffee. They are here locally in Charlotte. Medium roast. I freshly AeroPressed this morning. Oh my gosh, amazing. And update real quick, and then we'll get into what we're going to talk about today. With the coffee brew through the AeroPress, I finally invested in a manual coffee grinder. So you have to actually grind the coffee manually. I'll do a little video on that later, but yes, we're outside, lots of traffic going on, sorry about that, but big trucks. All right, so update on my patient who went to an ortho a while back, an orthopedist, a medical physician, and she was complaining of knee pain. So if you look back at the previous coffee talk, and basically when it came down to it, that patient followed up with that ortho doc probably 2 weeks after that initial visit, and he basically told her that she should discontinue any lunging or squatting or any type of those movements because it's causing her knee pain. Meanwhile, the patient was able to function normally throughout the day, just some aspects where she did get into a deep squat where she got a lot of this knee flexion. She kind of felt some pain and discomfort on the front of the knee as well as in the back of the knee when she got into that full depth position. So needless to say, that patient got very turned off from that orthopedist in what he said. And you know, words matter when we speak to our patients. So needless to say, correlation does not always lead to causation. So from a clinician standpoint, when that patient came back in and followed up with me, she told me what was going on with her. She told me the answer. So she said it hurts when I get into full knee bend, right? So either a deep squat or maybe she's squatting on the ground like this, and she's trying to tie her daughter's shoes, right? That's a functional movement. Well, she can't not avoid that, and the ortho expects people, or in this case, her to avoid that full knee flexion. But she told me a key point. When she was in her CrossFit class doing some squatting preparation movements, she had a band around her hip. So I was like, you know what? Let me just see what this knee bending will do if I bend it to a specific position and just give it a little bit of input, mechanical input. Well, she was able to fully bend without pain. So my thought process was there perhaps may have been some swelling inside the knee joint that was preventing her knee from fully bending. She told me the answer. Now I can't see if there's swelling inside the knee, but by applying a specific technique in order to help her knee flexion or the knee bending to occur, and then retesting her sign or the full kneeling as if she was tying her daughter's shoes, it cleared it. So going back to this orthopedist, she's never followed back up with him, and there's no need to, because she is sleeping without pain. She's doing her normal routine without pain, with exception of getting into this deep squat position and trying to tie her daughter's shoes. That's the only aggravating factor that she has. And just by this recent, I had 2 follow-up visits in between this video and the previous, and It completely cleared her ability to perform full knee bending. So correlation, i.e., perhaps the lunging or the deep squat may have caused the swelling to kind of occur inside the knee, doesn't always mean causation. So you have to listen to the patient. You have to really take in on what makes it better, what makes it worse, what are they doing at home, what have they tried, and not only that 1 hour that they spend with me for physical therapy, but what are they doing outside of that? Are they actually helping themselves to get better, right? So there's no need in this case to further her treatment path down the medical physician route with the orthopedist, which then perhaps would have led to an MRI, and then perhaps a cortisone shot, and then perhaps, the big S word, surgery. None of that stuff is even warranted. So if you're out in the Charlotte area, or even out West Coast, you're listening to this video, you need to find a good physical therapist who actually listens to what you're coming in for. Because you don't always and should not always go down that surgery route, especially when it's a musculoskeletal type injury in nature, meaning the muscles and bone in the way that you move. That's what physical therapists do. We assess human movement and then try to optimize that human movement without pain. And then also incorporating some other aspects of the health and wellness field. But just wanted to give you guys a little bit of an update. So if you're on the fence with something like this, maybe it's something in your shoulder or your knee or hip. If you're in the South Charlotte area, definitely reach out to Fortress Physical Therapy. I would be glad to help you guys out. And if I am not your person, I can try to help find that person for you. So, moral of the story. Correlation is not always causation, right? You have to listen to the patient complaint, the symptoms, and then getting that patient back to life ASAP, right? So I'm going to finish up my coffee, but just a little tidbit, little update on some FPT Coffee Talk. But salute, it's a beautiful morning today. Mickey Mouse, and gonna listen to the birds chirp a little bit. All right, talk to you guys later.